So today we're going to be talking about bloodborne pathogens. And this quiz will be on Monday, September 9th. So OSHA is the Occupation Safety and Health Administration. And in 1991, they developed the bloodborne pathogen standards. And these standards were developed to demonstrate occupational safety with regard to occupation exposure of bloodborne pathogens. So who is covered under this standard? And that's any employee who has the opportunity to come in contact with blood or body fluids in healthcare. We fall under this category. So CVT techs, x-ray techs, doctors, physicians, the secretaries, anybody who has that chance that could come in contact with bloodborne pathogens is covered under the standard. So each hospital, each physician's office has a responsibility to meet the standard. Employees must have annual classes, training each year, and they are given that training during normal work hours at no cost to the employee. So your employer cannot make you come in on a Saturday or in the evening to have this training. And we just said some of the occupations that are covered under the OSHA standard. Also, some other ones that you might not think about are engineers, police officers, paramedics, out in the field. They are also covered under the standard. So bloodborne pathogens, this is taken right from your text. The definition is disease-causing microorganisms that may be present in human blood. They may be transmitted with any exposure to blood or OPIM, which is other potentially infectious material. The two most common that we talk about is hepatitis B, the HBV, and HIV, human immunodeficiency virus. Other diseases, hepatitis C, hepatitis D, and syphilis. So an occupational exposure incident is a needle stick, if you cut yourself with a scalpel, if you get splashed in the eyes with blood or contaminated fluid, we call that an occupational exposure incident. So hepatitis B, the first bloodborne pathogen that we talk about, affects the liver, can be prevented via immunization. Some of the symptoms are listed here, and then it will be detected via a blood test. Now, hepatitis B, there is an immunization made by Merck SmithKline, and these prevent infection from hepatitis B virus. There's 3 doses given to the employee or to the student. First dose is given, then the second dose is obtained 1 month later, and then the last dose is given 5 months after that second dose. So you get 3 doses in a 6-month period. So for you guys, for the CVT students, you can decline to get this vaccine. However, we do highly encourage that during this class, before you go on to CVT 103, that you do get the hepatitis B vaccine. So once you start the process, you will not have all 3 doses prior to the start of CVT 103, but we want you to start it now so then you do have the 3 doses by the time you get accepted into the program and you're in invasive or cardiac sonography. You will have all 3 doses completed. So healthcare workers should receive hepatitis B vaccine, and then we encourage all healthcare students to receive the hepatitis B vaccine. It's not always 100% effective. If the first 3 doses do not take effect, they will give the vaccine to you a second time. They'll give you 3 more doses, and if it doesn't take effect, then chances are that you will not be able to have the hepatitis B vaccine. And if you wait till you are employed, they will give the vaccine to you at no out-of-pocket expense. Side effects from the vaccine are minimal, just like any other vaccine. The second disease, the HIV, human immunodeficiency virus, infects the immune system, the T4 cells. The T4 cells makes them less likely to prevent disease. This is the virus associated that causes AIDS. Symptoms are listed there. And lab tests may not become positive for 1 year after you've been exposed. So if you do get exposed to HIV during clinical, if you come in contact, if you get a needle laceration, if you cut yourself with the scalpel, they do encourage you to get tested at 1 month, 3 months, 6 months, 1 year, and then annually after that, dependent on if they were HIV positive. So we all know that you cannot identify someone who has hepatitis B or HIV just by looking at them. And because the symptoms do not appear right away, employees might not be aware that they have contracted the disease. So if you do get a needle stick or laceration, or if you get splashed in the eyes with contaminated fluid, you do need to report the exposure. All exposures must be reported to your supervisor and then to the emergency room, and they report that to OSHA. So there's 4 prevention strategies: engineering controls, work practice controls, personal protective equipment, and universal precautions. So engineering controls are structural or mechanical devices that the company provides. So these are the hand washing stations, the sharps containers, the biohazard labels, the red bag trash. These are all the things that your employer provides. The work practice controls is practice that should be controlled to minimize the chance of splash, spraying, or splattering of blood and other OPIM. Eating, smoking, drinking, and applying makeup in the work area is prohibited. And you're not supposed to keep foods or drinks in refrigerators where the blood or OPIM is stored. So the work practice controls is the idea that you're actually using those engineering controls. So you're actually using the hand wash stations, the eye wash stations, the sharps containers, the red bag trash. And then if you do get exposed, it is important to remove all protective equipment, wash your hands immediately, wash your eyes immediately, whatever area got exposed, and then follow the procedures when leaving your area. So if you do get a needle stick, if you were in the cath lab and you were scrubbed in and you get a needle stick, you would just let the physician know what happened, and then someone would come in to relieve you. You remove your gloves, go out, wash the area right away, and then go let your supervisor know, and then you typically get sent to the emergency room where you go through the protocol once you're there. And they will ask you if you had gloves on, if you were trying to recap the needle, what can you do to improve upon these things. They go through a whole list of questions, and you have to sign paperwork. And if they do know, obviously if you're in a cath lab and you're working on the patient, you know which patient you got exposed from. So we always get consent from that patient, and then they get tested for hepatitis B, HIV as well, and then you are tested as well. Worst case scenario would be if you got stuck from a needle that was in a sharps container and you had no idea who the patient was that the needle came in contact with. So just an overview again: engineering and work practice controls. Work practice controls are behaviors that take advantage of the engineering controls, like using the hand washing facilities, using the eye wash stations. And the hand washing facilities should be easily accessible to all employees, should be in a close area so there's no cross-contamination. So you should not have to leave the room to go wash your hands. Now, in many cath labs, in many echo suites, you do have to leave the room. If you do, there's usually push buttons on the wall to exit, so you would just use your elbow to leave the room. If hand washing facilities are not available, such as if a police officer was on site or paramedics or EMTs, they would use antiseptic hand soap or the antiseptic towelettes. And then once they get to the emergency room or the hospital or the police station, then they should wash their hands as soon as they arrive there. So personal protective equipment. So we call this PPE. We always use gloves and masks, gowns, shields, goggles to protect your eyes. If you do wear glasses, typically you would need the side shields to protect the sides of your eyes as well. And the use of personal protective equipment does not guarantee protection from bloodborne pathogens, and then any unknown substance should be assumed contaminated. So we said personal protective equipment, gowns, gloves, aprons, face shields, eye masks, CPR masks, the lead aprons that we use in the cath lab, that's all personal protective equipment, and it is supplied by your employer at no cost to you for your personal protection. So if you wear a mask, your face should also be covered with a shield or safety goggles. If you have your own glasses, like I said before, you should be sure to put side shields on it. Hypoallergenic gloves or powderless gloves will be supplied by your employer. If you do have a latex allergy, those will be supplied at no cost to you. Most hospitals don't even use the gloves with powder in anymore, and I'm pretty sure almost all hospitals have the hypoallergenic or they have the latex-free gloves. If you do get contaminated by blood or OPIM, you should remove your scrubs, place them in a proper container for cleaning. If it does penetrate through, you don't want to pull it over your head. They like you to cut the material away, take a shower if you need to. That's an extreme case. But be sure to remove the clothing and don't let it touch any of your other skin. Like I said, if you do get it on your shirt, you don't want to pull it over your head. But when you work in the cath lab, we have the hospital scrubs, so we can go right into the locker room and change. The echo students, you guys will have your own scrubs on, but you can certainly either go over to the cath lab or go to the operating room to borrow a pair of those hospital scrubs. So universal precautions. The definition is to treat all blood and body fluids as if they are contaminated by HIV, hepatitis B, or other bloodborne pathogens. So we treat everything as it's contaminated. Labeling. All regulated waste should be labeled so that there's no cross-contamination. We have needleless systems. Just a couple listed here. Retractable needles, needle guard hinged recap. This is just new systems that were developed to lessen the chance of getting a needle stick. So the retractable needles, if you start an IV, there's a little plastic encasing around the needle, and that's what actually stays in the patient's arm for an IV now. The needle would retract back into the protective casing, and then that would all get thrown into the sharps container. But several systems are needleless now to reduce that risk of sticking yourself with a needle. Contaminated sharps are thrown out in the sharps containers, and you should never recap the needles. If you do, there's a one-handed technique to recap the needles. Reusable sharps, many hospitals have done away with this practice in the cath lab, but if you need to use reusable sharps, they do get washed at the end of the procedure, and then they are placed in a bag and taken to central supply where they would be re-sterilized. I think Hershey Medical Center is one of the few cath labs that still use the reusable trays. Most places have the disposable trays that at the end of the case everything gets thrown in the trash. Labeling acceptable containers for the sharps containers. There's 4 criteria that must be met. They have to be closable, puncture resistant, leak-proof, labeled, and color-coded. So there's just a picture of the sharps container. Labels must be easily shown on refrigerators, waste containers, and other transport materials, so if a worker comes in contact with blood or OPIM, they can distinguish if it's harmful material. And then remember to place the sharps or other container in a second container if the outside of the original container gets contaminated. So if the sharps container does get splashed with blood or OPIM, then just take that container and put it into a second container. And then the goal of labeling is to protect everyone who could be exposed. Housekeeping, so the work surfaces in your area, you will clean and keep that area free from contamination. Housekeeping does come in and clean the echo area and the cath lab area, but they are not supposed to clean the x-ray equipment, the echo machines, the computers. That's all left for us to take care of. So they do. Your employer will have a regular cleaning schedule. Typically, it's when you have downtime in the cath lab or downtime in echo that you would use that time to clean the area. Obviously, at the end of each case, you also will wipe the equipment down and wipe the EKG leads down and the blood pressure cuff. But, you know, you can do a more thorough cleaning when you do have downtime. And they will give you the appropriate solution to clean the areas. Laundry and waste material should be separated. You will have linen bags, you'll have red and regular bags for trash. So this slide is taken from your text, and this is one slide that I really don't agree with, but it does separate which fluids require precautions, and it does actually say that some don't require precautions unless the substance contains blood. My issue with this slide is that you're supposed to treat all blood and body fluid as it's contaminated. So how do you know if the urine has blood in it or the vomit has blood in it or the sputum? You don't know. So everything on this slide should be treated as if it were contaminated. And you should always use precaution with any of these listed here. So bloodborne pathogens are transmitted if blood and OPIM come in contact with mucous membranes, non-intact skin, or by handling or touching contaminated items. They can also be transmitted by skin puncture wounds or cuts from contaminated sharps. So we use universal precautions. Wear personal protective equipment. Wash your hands after each procedure, patient, or contact. HIV will not survive as long on a surface or instruments. Hepatitis B has the ability to survive for at least 1 week in dried blood on surfaces and instruments. And HBV can be transmitted through chronic carriers. The person may transmit this through transfusion, needle penetration, injury, or intimate contact. So exposure determination. If you have an occupational exposure incident, this occurs when you are at work and you come in contact with blood or OPIM. All needle sticks, splashes, or cuts will be called an injury under the OSHA guidelines. If you become exposed, stop. You clean the wound and seek treatment, document where and how the incident occurred, and then obtain testing for HIV and hepatitis. So the requirements under the OSHA standard is that all employers have an exposure control plan. Each employer will have an occupation exposure control plan in place for each employee. The employer will keep a record of which jobs are potentially at risk and a list of which tasks put the employee at greater risk. And that's, our exposure plan for the invasive students is a little different than for echo, because the invasive CVT students, when you're in the cath lab, when you're working in the cath lab, you have a greater incidence of being exposed to bloodborne pathogens than do the non-invasive CVT students. So our exposure control plan looks slightly different than an exposure control plan for echo. So the exposure control plan assumes that no personal protective equipment has been used, and employers must demonstrate that a copy of the plan is available for the employees to see. And it is renewed and updated annually. So this is some terminology that's taken from your Bloodborne Pathogens text. And I did highlight the ones in red. And those terms will show up on your quiz on Monday, September 9th. So just make sure you review those terms and review this note packet prior to the quiz on the 9th. And if you have any questions, you can see me in class or you can email me at any time. Thank you.